All right, let's turn our focus to this now. AfriForum says it has served summons to government over what it calls unconstitutionality of the National Health Insurance Act. The civil rights organization wants the act to be declared unconstitutional. The case is being served on 5 defendants, namely the President, the Minister of Health, the Minister of Finance, the Speaker of the National Assembly, and the Chairperson of the National Council of Provinces. Well, to further unpack this, we are now joined via video link by AfriForum's spokesperson for Health, Louis Boshoff. Louis, a very good afternoon to you. Thank you for your time. So your legal action comes amid, of course, multiple concurrent legal challenges, including by hospital associations and private practitioners, as we've been seeing. Just talk to us through what specific provisions do you believe it violates the Constitution, and what legal basis?
Yes, thank you for the invitation. So first of all, Section 27 of the Constitution mandates government to achieve progressive realization of access to healthcare. And we reckon that NHI is irrational in this regard because there's simply not enough taxpayers in South Africa, simply no way of acquiring enough funding to successfully manage a system such as NHI. And in that case, it will probably achieve the opposite of what the Constitution mandates, namely a regressive realization of access to healthcare, or at least not anymore access to healthcare. So we believe it's in breach of Section 27 of the Constitution. But it also goes against patients' rights of choice, where NHI will mandate patients to only register at a specific healthcare facility and first of all go to that facility and have no choice on where they want to be treated at first. But the same goes for doctors and other healthcare practitioners whose freedom of trade and occupation will be hampered by the NHI framework. And then also the question of provincial rights, according to the Constitution, where provincial governments, their powers and governance powers will be diminuted by the NHI Act, and most of the governance will be centralized to the national government. And we believe this goes in against what the Constitution intended for what is the responsibility of national government as opposed to provincial governments.
Yeah, you also cite, economic impracticalities around this implementation. I want to talk about this. Given parts of the Act have already been struck down by one of the high courts, I mean, do you believe that this then strengthens your case?
So it's not parts of the NHI Act that has been struck down, instead parts of the National Health Act regarding the certificate of need has been struck down. And it probably sets a precedent for NHI, but we'll have to wait and see about that. But for the most part, we haven't heard any viable plans to acquire enough funding for NHI. The Department of Health has repeatedly mentioned medical aid tax credits, and then the Minister of Finance, on the other hand, said that would be an attack on the middle class, and we cannot do that. And even if medical aid tax credits are taken away, then it still wouldn't be enough money for a fully functioning NHI system. And many economists have already pointed out that South Africa is at the peak of its Laffer curve, meaning that no more tax income can be acquired by the revenue service, meaning if tax rates are raised even more, more businesses would instead decide to leave the country, or business people decide to leave the country and not pay taxes anymore, resulting in no higher taxes, even though the tax rates have been raised. So there's no way we foresee that NHI can successfully be funded.
All right, our time has run out, unfortunately, Louis, as I was about to ask you about your stand on universal coverage, but perhaps another day, of course, another legal process there against the NHI. That is AfriForum's spokesperson for Health, Louis Boshoff.